me welcome to the show pediatric dentist Dr. Paula Coates. Welcome.
Hi, thank you for having me.
Thanks for coming through. We've had so many dentists on Wellness Wednesday, but I don't think we've ever had a pediatric dentist. What is the primary difference? Like, how do you dentist differently? Is that a verb, to dentist? I think we can make that
differently.
Yes.
Well, thank you for having me again. As far as pediatric dentistry, we are an official specialty of the field of dentistry, and we study a couple of years, usually 2 to 3 years after we finish dental school, and we focus on all things children, from infancy to adolescence and even individuals with special health care needs. What sets us apart, I think, is the fact that, one, we love children, and we can deal with moving targets because they can't sit still, whereas a lot of other dentists are like, please, I can't see them. But we know how to handle them. We know how to handle their behavior, and we try to make it the most positive experience for them, such that they don't grow up to be adults that have fears because they had a traumatic experience as a child. So I think that we're pretty much very patient people. We tend to be very happy, loving, very animated individuals. We're a special breed. So that's what I would say what's different. And like I said, we have to work in very, very tiny spaces. So
Why did you choose dentistry? Yeah, you got to go to medical school and go through all of that. Why the mouth, Dr.
Why the
Coates?
mouth? I think, I'm a child of a nurse who happened to work for a pediatrician here in D.C. And his wife happened to be, at the time, the dean of the College of Dentistry at Howard University, Dr. Gene Sinkford. And I always knew that I wanted to do something in the health field. At first, I wanted to be just like him. I wanted to be a pediatrician. But then as time went on, I was one of those kids that my grill was kind of jacked up. I had, crowded teeth, and I got braces on early at 8 years old. And, I kept them on for a while. And I finally got them off when I was going into high school. And I knew that day, I was like, okay, when I saw my smile, my beautiful smile, I was like, I want to be a dentist. And because Dr. Sinkford was around in my life, I was like, hey, I want to be, at the time, I didn't know what a dean of a dental school did, but I was like, I want to be a dean of a dental school just like her. So that's how, from 14 on, I was determined. I'm like, I'm going to college. I'm going to be a dentist. None of my friends wanted to be a dentist. And then once I got in, I was accepted into Meharry Medical College School of Dentistry, in one of the 2 HBCUs that have a dental school. About my third year, I started working for one of our professors who taught pediatric dentistry, and it was just an awesome experience with the little kid and just talking to him. And I knew right then and there that's what I wanted to do. And it sort of came natural. My mother used to always say that I was a kid magnet. And kids just were drawn to me. So I think, it definitely, God meant for me to work for kids. So that's how I ended up working with kids.
866-801-8255. I'm going to invite the audience to ask questions if you have little ones with little mouths, if we have someone in that specializes on that. Go ahead, Loree. You have a little one with a little mouth.
I do. I have 2, one of whom we just found out needs braces. So trying to figure that out.
Wait. Let me. So I didn't include Nasir because I know he's heading towards manhood. So I didn't want to put him in the little kid, position. But is that considered a child? What's the age range of pediatrics?
Yes. Well, actually, a lot of us will start at a couple of days old. We've had kids that were born with teeth. Up until around like 18 years. Most of the time, when kids go off to college, we'll sort of graduate them out of the practice. But I know my pediatric dentist was still seeing me when I would come home from college breaks until I was about like 21. So each different dentist has their own preference, but usually until about like 18, 19, that's when they leave. So, and then again, like I said, we sometimes see special health care need patients. So we might have older individuals that are autistic or have Down syndrome that are in their 20s, 30s, 40s, maybe even 50s. So that's usually the age range that we have.
I absolutely love my pediatric dentist because she is a Black woman who, has said similar things. Like she was inspired by it and then seeing other people in her life. And I am amazed at the level of patience, because just trying to get my kids to brush their teeth is not something that I have, I'm not the most patient of people when it comes to those types of things. As you're trying to navigate your just day-to-day practice, what are some of the more challenging things, other than having parents in the room who should not be there because we're too interruptive? What are some of the more challenging aspects to your job that you encounter treating patients who are so young? And how are you able to still treat patients during COVID? That's actually been one of my fears, is do I take my children to the dentist during a pandemic that is spread by airborne particles that come out of your mouth? And no, what is that transition to dentisting? I'm going to make that a word. Dentistrying during a pandemic.
Okay, well, I'll start with that question as far as COVID-19. What I will say that dentistry as a whole has been at the forefront when it comes to infection control. Back in the day when the HIV crisis and the AIDS crisis came on board, before then, dentists were practicing without masks, without gloves. And so that brought about the onset of, wearing gloves with each patient, wearing masks. So we have really worked hard at using our PPE. We definitely use evidence-based to make our guidelines as far as infection control. So for us, we pretty much just had to add extra. So for instance, like in our office, we always wear coats, but now instead of launder coats, we're doing disposable gowns. And for myself and a lot of my beautiful sisters that practice dentistry, we tend to cover our hair regardless, just because of, all the spray. And so we have the little bonnets, and now we have the disposable bonnets on top of that, shoe covers. We now have the shields. So we're doing that. We also have, I think you guys are familiar with that suction that sort of sucks your cheek, when it's like there's the straw, that's the low volume suction, and then there's the high volume suction, the one that sucks really hard. That actually sucks out a lot of, aerosols when you're in the mouth. So we have had to make changes, like with social distancing. We cannot have as many patients in the office at one time. We have to give more time to actually clean down, the chairs, wipe down, allow the spray if we have to do that. And that's usually with filling appointments. A lot of people now with their cleanings, we're not really using the motorized brushes. We're using hand instruments and then brushing the teeth that way in order to keep the splatter down. But oral health is very important. It's integral for overall health. So we definitely don't recommend, people don't, to skip your dental visits. We've seen a lot of, kids come in that, stopped. We had to stop care, like in the state of Maryland in the beginning of March, middle of March. And we started back up at the end of May. And we saw a lot of kids, unfortunately, that had cavities that we hadn't been able to treat. Now they're in pain. So we definitely don't want you to say, don't come in, but if you're going to the dentist, and if your dentist is not, adhering to guidelines, they're not wearing masks. Everybody's wearing a mask in the office. If they have patients packed in the waiting room, one on top, that's not right. That's, you might want to find another place to go. But as far as kids, like what's so challenging, let's see. You mentioned parents, but I'm not going to mention that. We love the parents. But I think, when a child is just so afraid, I think because of, someone told them that their visit was going to be bad. And it's usually an older sibling or a cousin or a friend from school.
Yep.
And you're like, sweetheart, who told you that? Or they think that, you're laying them back and then you're looking in their mouth and you're like, are you going to kill me? Kids have literally asked me that, and we're like, oh, no, baby, no, we're not going to do that. So I guess, just having a child that's fearful, it's a challenge. But, that's where, our behavior guidance skills come in. That's where we get creative. We make it fun. It is hard sometimes when we do have to deal with patients that have, special health care needs, like autism and things like that, where they're just not, going to have it. So sometimes, it takes a lot of time and effort to get them in the chair. Then we may not even be able to get them in the door the first time, but by the time we're able to get them in the chair, get them to open their mouth, it's the most rewarding feeling. But again, and they move. So, learning how to hold the mirror and the little instrument that everybody says looks like a hook, we call it an explorer, having to use that while the child is kicking and their head's moving and thrashing about is challenging, but that's what we're trained to do. So,
Dr. Paula L. Coates, and as you're talking, I remember as a kid, and I never got to do this, the red tablet. I always wanted the red tablet that would show all of the areas that I didn't brush. My mother would never get me the. Do those still exist? Do we still have the red tablets?
They do. A lot of people. They also have disclosing liquid where you can squeeze it on a little cotton swab and swab it. We don't use it in our office, but they still do have it, and some people do. It does stain the sink though.
Okay.
You can find it, yeah. But it is good. It's really good. Again, my pediatric dentist, he's Dr. Joseph Latta, one of my inspirations for being a pediatric dentist in Silver Spring, Maryland. He had a little station that we had to stop, and there was like this old piece of equipment that you would shine this light, and it had a mirror, and it really made the pink areas show up so dark, and you're like, woof. So we had to, brush before we went to go see him. But, the disclosing tablets and solutions, they still have them.
866-801-8255. We have a few people that want to talk to you. What's the biggest way to prevent cavities in young people? Because you said there are kids that had cavities that were attended to, and then they had pain. How do we prevent? Is it genetic, or is it all candy based?
Well, for the most part, it's so the process of cavities pretty much is like everyone has bacteria in their mouth. We're not born with the bacteria. We actually get that from what we call vertical transmission from a parent, a sibling. Like when you kiss in the mouth or share utensils, that bacteria is passed to the child, and it needs to colonize on a hard substance, i.e. the tooth. So once the bacteria grows, the bacteria needs something to feed off of, and that's usually the food, the plaque. And certain types of foods, like foods that are rich in sugars or rich in starches, is what the bacteria loves. And the bacteria will feed off of that and produce acid. And the acid is what in turn starts to eat away at the enamel or the white substance of, surface of your tooth and causes the cavity. So, once you get the bacteria, you can't eliminate the bacteria. However, what you can do is eliminate the source of the food. And that's through brushing, that's through flossing, that's through making sure you go to see, your dentist, your pediatric dentist, every 6 months. That's also getting fluoride treatments, because fluoride has an antimicrobial effect as well, and it helps your teeth to get strong, such that you can, it can stand against the acid attack. But, diet is important too. Things that you drink, trying to avoid, sugary drinks and acidic drinks. And just like I said, again, making sure that you brush your teeth. And for children, we can't expect kids to brush thoroughly on their own. Usually until about the age of 7 or 8, or when they're able to, tie shoes or, have really good dexterity skills, a parent or an adult needs to go behind them and brush. We want them to learn how to brush, but you have to have supervision because they're going to leave stuff behind. And that's when you see the caries rate goes high.
What about salt pulling? Does that cut down on the bacteria? I'm asking for a friend.
That's
coconut
something
oil.
Yes.
I haven't read too much about that, so I can't really comment. I have heard about it, but anything like rinsing your mouth with salt water. They're also on the market rinses that have a peroxide base in it that could also help. We have started using a little peroxide with water rinse to help sort of reduce the bacteria prior to cleanings, but definitely the best way is the mechanical removal of the plaque with toothbrush and with toothpaste, usually fluoridated toothpaste. And floss.
866 and floss. Floss with kids, though. Lori, your daughter, does she floss? And how do you get children to floss?
We have the little kid flossers that have it's on a stick and it's like a string between a space, and then she goes to town. Unfortunately, she's a little OCD on something, so she's like, oh my God, my gums hurt, because she does it a little too much, so we have to watch her. But yeah, she does.
Good habits. You're a good mommy.
Yeah.
All right, let's go to the phones. 866-801-8255. Got to raise them up, right at a young age, and then they become great adults. Charity in Georgia, you're on with Dr. Paula Coates. Welcome.
Yes, hi. Love your show. I am a fan. Hi, Karen. Hi, everyone. My daughter has the worst breath. She's only 6. We brush, we floss, we gargle. We do all of everything 6 months, but her breath is just, oh my gosh. Help.
Okay. Help. Are you? Well, thank you for your question. Yes, that's a very common concern for a lot of parents.
Wait, hold on. They're little. How bad could the breath be at 6?
Well, you'll be amazed. Yes, it can. Are you brushing the tongue, cleaning the tongue as well?
We are. It's like the target as of now. Yes, we are. And it's just, we do it like 2 or 3 times in the mornings, because it's just like, ooh, it's terrible. It's terrible.
Is it? What about her diet? I'm just curious. Is it coming from the stomach?
Okay. Well, so she has eczema, so we're not like eating a whole lot of anything. She's allergic to a lot of things. So we don't do a lot of sugar. We do a lot of veggies, a lot of fruit, no juices, no soda. So that's why I'm really at a loss, because I watch what she eats.
Dairy?
Her breath is just
dairy?
terrible.
Because eczema also speaks to a gut issue. I just know because I've had it since a kid. That's also a gut situation. But go ahead. Hey, Doc.
Yeah,
just shut up.
No dairy.
Sure. Does she have allergies, like seasonal allergies, like hay fever?
She does have allergies.
It's like post-nasal drip, a lot of times post-nasal drip. But Ms. Hunter, Ms. Karen was right also. It can be, GI issues too. And that's something that, if you want to speak with your pediatrician about as well. But brushing, flossing, I mean, when you smell floss, literally when you floss and you smell it, it smells bad. Old plaque smells terrible. So the brushing, the flossing, the cleaning of the tongue, the, checking into, how her sinus passages are, could also be contributing. Also, does she drink a lot of water?
She does. We really only drink water.
Okay, because dry mouth can also contribute to bad breath. And usually, like in the morning, when you go to sleep, you're not really producing a lot of saliva in your mouth. So when you wake up in the morning, it's usually, dry.
That's when it's the worst.
Tasting. Yeah, and that's,
that's when it's the worst.
Yeah, because, so that saliva, it has, natural cleansing property, and you're not producing that when you go to sleep. So, but again, if you're continue to be concerned, I would, talk to a pediatrician about that just to make sure there's nothing wrong with her GI system. And also, like I said, as far as her your sinus issues or hay fever, allergies, making sure that we're not having like the constant post-nasal drip.
That's great.
Okay.
What about the peroxide? Thank you, Charity. I'm sorry that your baby has bad breath. What about the peroxide? How much peroxide should you use as a rinse before you brush your teeth? Because I do that little peroxide swish around before I brush my teeth. What about that?
Usually, like if you had a cup, you'd probably like the how many parts? Maybe like a third. Okay, yeah, in the rest water. There's also some brands out like Peroxide is a rinse that has a peroxide agent in it. But pretty much just like, the bottom of your cup and then the rest water. Don't put like all peroxide in it. That would just burn, and that's not what you want to do. But definitely dilute it. And it helps. It helps. And as well as, saltwater rinses too helps too.
Salt is a healer, natural healer.
Yep.
Salt pulling, I love all of that. And it just feels clean. And then the bubbles with the peroxide, just
Right, the
ladies,
bubbles.
love the bubbles. What about the what type of filling? Because when I was growing up, it was those metal fillings that they told us to get rid of.
Yeah.
Right.
Yeah.
And then there was a study that says that the enamel doesn't work as well, or whatever they're using now, that white substance. What do you use to fill teeth, and what's healthy or good?
Well, we use the composite resin filling. That's the tooth-colored fillings that we use. The amalgam, that's the silver fillings. They're still, you still can use them. They're still good quality. We don't happen to use them in our office. But the white fillings, definitely, they're more conservative. You don't have to take away a lot of tooth structure. You pretty much just remove the cavity as is, and then you fill it and shape it up, to make it look like a tooth. For children, there are other fillings, that you can place as far as, well, it's not a filling, something like sealants. That's a preventive coverage of the back teeth that you can place on, especially adult molars, to help prevent cavities on the chewing surfaces. But nowadays, the white materials, they've definitely improved. They can withstand more force of chewing as opposed to the older, quality. They're more colors that match the tooth better. So we do use that a lot. And again, the silver fillings are okay. It's just that you can't use them like when the cavity is big. You don't tend to use, silver fillings for big fillings, especially in baby teeth.
And baby teeth. Do baby teeth need to be filled? Because they're falling out anyway. Why waste the money?
Well, you should. Yes, you have to. You should. And depending on the age of the child, teeth are important. Not only, they are living tissues, and if there's decay and it goes untreated, in a baby tooth, a cavity can go from like the top of the surface within 6 months down to the nerve, and now we have pain, and it could lead to infection. Also, teeth are the natural space savers for teeth that replace. So if you're losing teeth early, there's a good chance that teeth will shift and all kinds of stuff. And we want the child to, one, feel happy about themselves. We want them to feel healthy. A child who's in pain can't focus, in school. God forbid now that they have to sit on the computer. If they have a toothache, I know they really couldn't concentrate. So we definitely treat, the decay. And then when the teeth are like to a point where they're about to fall out, and if they have like a little cavity, then in that case, we're probably just going to either take the baby tooth out or just let it fall out on its own. But a lot of these teeth don't start falling out, especially the back teeth, until about the age of like 9, 10, or 12 to 13. So, they're in the mouth for a long time, and it spreads. So if it could be on one tooth, the tooth that opposes it can get a cavity, or the tooth that's next to it can get a cavity, because, dental caries is an infectious disease. So we want to make sure that, we deal with it and nip it in the bud so it doesn't spread.
I just learned something. Thank you, Dr. Paula Coates.
You're
and
welcome.
Let me just thank all pediatric dentists, because my mother, when I was 12 years old, one of my neighbors, we were playing, he pushed me down, my tooth went through my lip, and instead of taking me to the emergency room, she took me to the dentist and saved my tooth.
Awesome.
And he put it back in my mouth, and it held for 18 years. So let me thank a pediatric dentist and stitched my lip. I don't think he did a good job stitching, but that wasn't his job. His job was to save my tooth, and he did that. So shout out to Dr. Washington, and I want to thank you, Dr. Coates. How can people reach out to you if they want to send their child to your dentistry?
Sure. Well, I work at Johnson Pediatric Dentistry. We're located in Bowie in Hydesville, Maryland, outside of Washington, D.C., and our website is www.johnsonpediatricdentistry.com, and they could always email me at info@johnsonpediatricdentistry.com. I'll be happy to give them a shout out and hit them back.
Yes, and you can follow her on Twitter as well at Paula L. Coates, like Laura Coates, no relation, but all the same family. Thanks for being here.